prostate has been swelling for 10 years. You have not noticed. Count last night. Did you get up to urinate more than once? Now time yourself the next time you go. Does it take you longer than 30 seconds to finish? If either is yes, the gland under your bladder is already on a 7-stage ladder, and you cannot feel it climbing. Most men walk away clean from stage 3. Stage 7 is different. Stage 7 is the vertebra in your spine that suddenly snaps, because by then, the gland has been seeding your skeleton for years. Most men listening to this will check the toilet tonight and tell themselves it is nothing. This is how your prostate slowly strangles itself in 7 stages. You think the prostate is small. It is, until it starts strangling the tube that runs through it. The gland sits under your bladder, wrapped around your urethra like a hand around a garden hose. When it grows, and on most men, it begins to grow slowly from the late 30s on, the squeeze starts. By the time you notice the stream weakening, the squeeze has been there for a decade. The gland does not announce its growth. It does not show up on the bathroom scale. It does not tell you that the same hormone driving your hair loss is also driving the gland under your bladder larger every year. Most men never notice this system until it has already failed permanently. The first warning is usually the night you cannot urinate at all, or the PSA result that came back high, or the back pain that turns out to be a vertebra collapsing from a metastasis nobody flagged early enough. For many men, this is not a story about old age. It is a story about the years they spent ignoring a routine blood test because nothing felt wrong. 7 stages, each one more permanent than the last. By the time you can feel the rung you are on, 3 more have already broken behind you. Stage 1. The silent growth. This is the stage you cannot feel, and it is the one that determines everything that comes after. Around age 40, the central zone of your prostate begins to grow under the influence of dihydrotestosterone, the same hormone that drives male pattern hair loss. The gland volume climbs above 25 milliliters. This is benign prostatic hyperplasia, BPH. You feel nothing. But here is the part nobody tells you. The growth is silent for years before the stream weakens. A digital rectal exam might catch the early enlargement. Most men do not get one until something already feels wrong. By the time the urologist's finger confirms what is happening, the gland has been compressing the urethra for 5 to 10 years. Your hair did not vanish overnight. Neither did this. The growth is not your fault. It is what the hormone driving your testosterone for 50 years was always going to do to the gland under your bladder. And this is where it becomes permanent. The gland does not shrink on its own. You can slow it with medication. You cannot reverse what is already there. Quiet, daily, for years. But the silent growth is the loudest stage on this ladder. The next one is the first one you actually feel. Stage 2. The stream weakens. You start to take longer at the urinal. You stop and start without meaning to. You finish, sit down, and then have to stand back up because there is more. This is the squeeze. The enlarged gland is now compressing the urethra running through it. The American Urological Association symptom score climbs above 7. Approximately 50% of men over 50 are sitting at exactly this stage right now. The strange part is the rationalization. You tell yourself it is just aging. Your father said the same thing. His father said the same thing. The men in line at the urinal beside you are also telling themselves the same thing. None of you are entirely wrong. None of you are entirely right. This is the only stage on this ladder you can feel, and it is the one men are most trained to ignore. Every time you finish in 2 minutes instead of 30 seconds, the gland behind it has grown another small amount. You will not feel that growth. You will only feel the result later. The stream weakening is not the disease. It is the first symptom of the system that produces the disease. What happens next is worse. The next thing the gland does is start releasing markers into your bloodstream that nobody is checking unless you ask. Half stage, the false normality. You are not feeling worse anymore. That is part of the problem. The chronically enlarged prostate does not stay alarming. Within 6 months of the first weakening stream, your subjective sense of normal urination quietly drops to match the new baseline. You stop noticing the slow finish because the slow finish has become the default state. But here is the thing. The gland in your scoring questionnaire, in the bladder muscle that is now thickening to compensate, in the blood marker that is now drifting upward, none of it has improved. You have simply lost the ability to feel it. This is why the men most affected by BPH are the ones most likely to insist they are fine. They are not lying. Their internal calibration has stopped sending the warning signal. The signal was annoying, so the body turned it off. You are not getting older. Your body has stopped telling you what is happening. And then the marker in your blood starts to climb without you noticing. Stage 3. The PSA flag. Your doctor runs a routine blood test that includes prostate-specific antigen, or PSA. The result comes back at 4 nanograms per milliliter or higher. This is the first hard data point that something is structurally changing inside the gland. The PSA is the gland leaking proteins into your blood at a rate higher than it should. The number itself does not tell you whether the leak is benign enlargement or early cancer. It only tells you that the gland has crossed a threshold. Here is the part nobody tells you. The PSA does not need to be high to matter. The velocity matters more than the absolute number. A PSA that climbs from 1 to 3 over 2 years is more concerning than a stable 4. Most men do not get year-over-year tracking. They get a single number looked at in isolation every few years, and they go home. This is the last off-ramp where watchful waiting alone still works. Catch it here, get an MRI, take the velocity seriously, and you can hold this stage indefinitely. For many men, this is the last warning the body will give the conscious mind. Everything that comes next is the body informing the doctor, not you. Stage 4. The biopsy. A transrectal biopsy takes 12 to 15 tissue cores from your gland. The pathologist grades each core. The grading scale is called Gleason. Gleason 6 is the most common finding at this stage. Slow-growing, localized cancer that may never threaten the man who has it. But the strange part is the math. About 34,000 American men die of prostate cancer every year. 260,000 are diagnosed. Most localized prostate cancer is not what kills the man who has it. It is what kills the man who waits. The report arrives as 15 black words on white paper. The man reading them will remember them for the rest of his life. The urologist explains the words. Your wife asks what comes next. The room gets quieter after the word surgery. You came in to get a number. You are leaving with a decision. Stage 5. The treatment cost. Radical prostatectomy removes the entire gland. Radiation therapy burns it from the outside. Both cure localized prostate cancer in roughly 70 to 90% of cases. Both come with a bill the brochure does not show you. Urinary incontinence affects approximately 10 to 30% of men post-surgery, often improving over the first year, sometimes not. Erectile dysfunction affects roughly 50 to 70% of men post-treatment. The numbers do not tell you what they feel like. Standing at a urinal you used to use without thinking and discovering you cannot finish standing up. Lying next to your wife and discovering that the body that used to respond does not. These are not side effects. They are exchanges you made when you signed the consent form, in language you only fully translated later. That is the bill. Now the part nobody itemizes. But here is the line nobody wants you to read. The conversations that decide which trade-off you take are usually held in 15 minutes, with a doctor who has held them 600 times before, and a patient who is holding it once. Most men leave the room with a decision they only half understand. Most men make it work anyway. Some do not. This is not the disease taking something from you. This is the treatment for the disease taking something from you. The gland was already broken. The cost is what it takes to make sure it does not break the rest of you. After 1 year, it is the recovery. After 5 years, it is the recurrence. After 15 years, it is the skeleton. Each layer of damage compounds quietly underneath the one above it. None of it shows up at the post-op follow-up where everything looks fine. None of it shows up at the cured 5 years milestone where you stop thinking about it. And the next stage is the one that explains why a man in remission still gets a PSA drawn every 6 months for the rest of his life. Stage 6. The recurrence. About 30 to 40% of treated patients see their PSA rise again within 10 years of definitive therapy. This is biochemical recurrence. The cells that left the gland before the surgeon arrived have been migrating ever since. The cancer either escaped the treated zone before treatment, or it seeded elsewhere quietly while the focus was on what could be cut out. The first sign is the PSA number. Not a symptom, not a pain, just a number that climbs at a follow-up appointment that was supposed to be routine. And then the second-line treatments begin. Salvage radiation, hormone therapy, androgen deprivation, The hormone that drove the prostate to grow in the first place is now driven down deliberately because the cancer feeds on it. The treatment becomes the disease. But here is what nobody tells you. Lowering testosterone in a 60-year-old man is not a side effect. It is a different life. Hot flashes, bone density loss, muscle wasting, permanent erectile dysfunction. The body that walked into the cured 5 years milestone is not the body that walks out of the second year of androgen deprivation. Quality of life narrows. The horizon narrows. The number on the next PSA reading matters more than anything else on the schedule. You think the recurrence is the disease coming back. It is the disease finishing what it started. Stage 7. The skeleton. Approximately 6% of prostate cancers are metastatic at initial diagnosis. Many more become metastatic over years of treatment. The most common site is bone, vertebrae, pelvis, ribs. Not because bone is convenient for the cancer, but because the cells that detach from a prostate tumor and circulate through your bloodstream appear to find the bone marrow's environment uniquely hospitable. The cancer takes up residence in the architecture that holds you upright. It has been colonizing your skeleton for years before the first fracture. The first symptom of stage 7 is often not a number. It is a vertebra that suddenly collapses under normal weight. A man bending to pick up his grandson. A man getting out of bed. A man whose back finally tells him what his PSA has been trying to say for months. None of this is dramatic. It is just slow. This is not aging. This is what compounded prostate cancer looks like at the end. The median survival from metastatic castration-resistant prostate cancer is around 32 months on current treatment regimens. Newer agents like enzalutamide and abiraterone have extended the runway meaningfully compared to a decade ago. The disease is still terminal. The runway is longer than it used to be. The worst part is invisible. Stage 7 is not a single event. It is the late-life catastrophe your years of unflagged PSA velocity have been quietly preparing. No symptom, no warning, just years. By the time the spine collapses, the runway is already used up. There is no warning before stage 1. There is no organ that takes the work back from a prostate that has been removed. There is no version of this that the body undoes on its own. Tonight will feel normal. The next physical will feel normal. The PSA at the bottom of the lab printout will look like a number, not a velocity. This is not a screening you skip because nothing feels wrong. It is the screening you do precisely because nothing feels wrong. The most dangerous thing about prostate cancer is that it feels survivable right up until the morning the vertebra snaps. When was the last time you had a PSA drawn? Comment the year, not the excuse. The men most damaged by prostate cancer are usually the ones most convinced they had it under control. Send this to the man in your life who has never had one.